What's up, everybody, and welcome back to the Move Better channel. We got Dr. Joe in the house, and this is John Pena-Serrata, and today we want to talk about SI joint versus, right there, versus sciatica. All right, what is the difference, and how could you know what you actually have?
So a lot of the times I get my patients that come in here and they're saying, I have sciatica.
Self-diagnosis.
Self-diagnosis,
Right.
or they just hear the word sciatica and they think they get it mixed up with SI joint pain. Now, sciatica is a nerve that gets impinged, and when that nerve gets impinged, you'll have radiation of symptoms. You'll have tingling and numbness, or going all the way down your leg, and sometimes to the bottom of your heel, sometimes to your toes, and you'll feel that pins and needles sensation going all the way down. Some people may have some weakness in the area if the nerve is pinched pretty severely. And so we need to figure out where that pain is really coming from. But this is not about sciatica. Today we are talking about what people normally misdiagnose themselves with, which is sciatica. This is SI joint pain. So when you're feeling local pain in this area, a lot of the time it's lack of function or lack of control in that specific area. And so one of the things that we do with our patients is we test, of course. We test to see if it's the posterior chain, and a lot of the time it is the posterior chain dysfunction. And what is posterior chain? When we talk about the posterior chain is a communication pathway between the heels all the way up to the head. Okay, and it's the posterior chain, it's the postural muscles of our back, of the things that keep us upright and be able to walk bipedal or with 2 feet on the ground. Now, with where you feel pain, this is a junction point. This junction point is a connector between the lower half and the upper half of the body. And so when we feel pain there, a lot of the time it's due to there being a blockage or a traffic jam in this area that communicates the top and the bottom of our body. Sometimes we could feel it more when we walk, and that's those are those signals that come all the way from the heel all the way up to the head. And so one of the things that we do is when we test it, we want to see how sensitive that area is, and we want to retrain your movement patterns to help you move upright. Okay? So today we're going to give you guys some exercises that you guys can utilize that's a little bit more than what we did in the past, which is we did in the past foam rolling, we did some stretching exercises. Today we're going to actually load it because we always want our patient to load the joints and load the muscular system at the best of their ability. And so today, let's go ahead.
Pain-free, though.
Pain-free, exactly. Now, if you guys are fitness athletes and people that work out all the time and are pretty good with lifting heavier weights, these exercises might not be ready for you. That's something that we might need to load the hamstrings a little bit more. But today, we're going to start with the lower half of the body, and we're going to try to load the hamstrings. We're going to load that posterior chains. Now, what I have John here set it up as is I have his feet just a little bit higher than normal. What we can go to make it a little bit harder for him is we can utilize a foam roller and have his feet a little bit closer to the ground. Then we're really activating that posterior chain. But for now, I just want the lower half to activate. I want his hamstrings, I want his calves to start to work so they can start to send communication from the lower half to the upper half of the body. So he's going to start feet together, toes together, big toes together. Keep it there. Place his hands flat along the floor, keeping that. Now, if you can't control yourself in this position, one of the ways that you can hold yourself is you could spread your hands a little bit wider. That will make it easier. If you want to make it harder for yourself, you start with your hands a little bit closer. And then all you're going to do is just bridge your hips. Bridge, bridge, bridge. Now here's the thing. I don't want pain in that SI joint. All I want to do is feel the hamstrings. I want him to feel the calves, and I want him to feel his butt muscles. Do you feel that?
Yep.
And notice what he's trying to do. If you look closely at what's going on here, the ball is shifting from side to side, and that's a normal thing. He's just trying to make sure that he doesn't roll off of it. So utilize the stability ball. Work on bridging the lower half of the body. That's going to force his glutes to start to fire the right way. It's going to force his hamstrings to start to fire the right way. Now, if this is still too easy for you, we're going to drop it down a little bit more, and we're going to start utilizing the foam roller. Let's see how John does on this. All right, so we're going to mess with John a little bit, and we're just going to see how well he does with something that's a little bit closer to the ground. Go ahead and bridge those hips up. Oh, easy. Was that way harder than the stability ball?
I feel it more.
You feel it a little bit more all the way. Now, you don't feel this in your lower back, right?
Well, it's starting to climb up a little bit.
It's starting to climb up a little bit. And he's going to hold this position, and you can hold your position on the stability ball for about a minute and see how that feels, and then see how your SI joint feels after that. See if you've decreased the pain fibers in those areas. And now, after he's done this is way too easy for him. So now, John, let's go ahead and lift your left leg straight up into the air. And so now, again, we're working those posterior chain fibers. We're working the glutes. We're forcing the glutes to start to fire the right way. And I notice I'm only having him work in one plane. I'm not having him do a clamshell. I'm not going to have him do a plank on the side. We're just trying to get the body to work in a normal fashion without any pain. Now, for the desk-bound worker, a lot of people that sit behind a desk all day long, they start to ask me questions about how a standing desk will work, or how a sit-stand will work, or a stability ball will work, if it would help that area of complaint or area of pain. In this case, one of the things that I recommend highly for people that are sitting behind a desk is if there's a way that you can get a pad for your knees and kneel down for an extended period of time, this will allow the lower half of the posterior chain to start to fire. The glutes, the hamstrings, the calves, in this position right here, it's forcing the front part of the hips to stretch out. And notice his posture immediately sits nice and upright. It's harder for his shoulders to even go anterior and slump because it just puts more strain on the body. It just feels uncomfortable in that position, right?
Yep.
And so trying to sit up now, try to get off of your heels when you kneel down. But if you guys have good knees and you guys can kneel down in this position, start kneeling down while you're at work if you can. So you could do those exercises. You could do all of your exercises from a kneeling position. You could do anti-rotationals. You could do core chops. You could do medicine ball training, medicine ball throws. You could do kettlebell clean and presses without the utilization of your lower half of your body. And this is going to force the glutes to do what it needs to do when you guys are retraining that SI joint or retraining those glutes to fire the right way. Okay, so the next exercise that we're gonna do is an exercise that will allow the upper back, the upper part of the posterior chain to help with the lower half. So we're gonna do an extension exercise. And so I'm gonna have John here lay down on his stomach, lay flat on your stomach. Now again, if you are at a CrossFit gym, or you guys are at a gym that doesn't utilize stability balls, there's different ways to do this. There's the glute ham raises, there's the, if you want to lay down on a box, on a plyo box, and be able to do these exercises, that's totally fine. If you want to do Superman exercises on top of a box, those all help. In this case right now, we're going to try to get John to utilize his balance with his lower back, with his mid back, to start to activate the whole chain. So you're going to straighten your legs all the way out, John. Spread your feet apart nice and wide here. And then from here, you're going to place your hands out wide like you're flying. Perfect. And that's all he's going to do. He's just going to hold an isometric control in the lower half. And notice he's contracting his lower back. He's contracting his mid back here. He's not looking his head up. His head is in neutral position here. And all he's trying to do is just activate that chain. Now, if that's too easy for you, you could make it a little bit harder for yourself by bringing your feet closer together, feet closer together, feet closer together, and then you could place your hands out in front of you, out in front of you, out in front of you. Good. And as his hands are there, now he's going to rotate his palms up to the ceiling. That's it. And now he's really forcing that contraction of his mid and lower back. Again, if he wants to make it even harder, he rotates his knees inward, gets his toes touching each other, and drives his heels outward. And when he does this, now he's opening up the joints. He's forcing stabilization of his lower back. Harder to balance, huh? Go ahead and relax. All right, so the last exercise that we're going to do is the hip airplane. Now, this is a great warm-up exercise before you do any type of exercises like squats, deadlifts, front squats, whatever it is. This is a great way to just kind of get the communication fibers activating. For my heavy lifters, for my power lifters, Olympic lifters, a lot of the time we don't do a lot of foam rolling right away. We go right into loading the joints, and we try to speed up the process of our warm-ups. And in this is one of the great ones. Now, for people that don't do this often, we're having John utilize a chair here just for a little bit of support. I try to have my patients very lightly hold the chair here. And while they're doing that, they're rotating their hip down all the way. And we're going to take this from behind as well so you guys can see it. And then he's going to rotate his hip all the way up, all the way up, all the way up, all the way up. Hold it as he's leaning all that weight and load on that left hip. And then he's going to rotate all the way down, rotate, and then he's going to come all the way back up again. Now, if you can, do this without your hands holding on to something to stabilize you. Place your hands across your chest or across your stomach here. Yep. And this is ultimately where I want you to go. Yeah, you can use your hands out to the side if you really need some balance and you're just still retraining. But get to the point where you can hug yourself and be able to do these ranges of motion. Now, when you first start out, high repetitions. Do maybe 1 to 2 sets of internal, external rotation. And the first few exercises that we did, we worked in one plane of motion, meaning we were just working the areas where we work front and back, right? In this case now, we're working on rotational patterns that will allow the hip to contract and stretch at the same time. And of course, working along your balance and reactions. There's your exercises for SI joint pain, not sciatica, SI joint pain. So if that helps, let us know in the comments below. If that doesn't, we can try to guide you and direct you guys to the right exercises that maybe we've done in the past, or we will set another video for you guys. Let us know how we did. Let us know how you did. Share with everybody that has SI joint pain that maybe confuses it with sciatica. Thanks for joining us, you guys. We'll see you guys on the next video.